Good evening. I am Dr. Shiban, MBBS DCH, specialized from world famous Madras Medical College. Okay. So today I am going to speak a very different topic which will make you to think. Today I am going to speak a very different topic which will make you to think. Okay. So my question is, or my idea of preparing this video is, why you cannot reduce your overweight by running or skipping or treadmill. Here the question once more. Why you cannot reduce your overweight by running, skipping or treadmill? Shall I repeat the question once more? Why you cannot reduce your overweight by running, skipping or treadmill? Okay. Second question. Why you cannot stop your sugar tablets, insulin, cholesterol tablets by walking, running and treadmill? Why you cannot stop your sugar tablets, insulin, cholesterol tablets by walking, running, skipping and treadmill? I hope the question is very different for you to think, right? So I am going to into the deep of the subject. Okay. So don't forget the question. Okay. Don't forget the question. Question is very important. Then only you will understand. Okay. Okay. So I am going to explain you two important points. See, first thing I will show one of my patient. See, this is a boy who was studying his 11th standard. He was 140 kgs, 140, and I reduced his weight by 70 kgs. So totally we reduced 70 kgs for this young boy, 140 to 70. Okay. So my topic for discussion is, why you cannot reduce your overweight by running, skipping, treadmill. That is the question. Okay. See, this boy is 11th standard studying, small boy, right? 11th standard studying, small boy, 140 kgs. If I allow this boy to run, if I say this boy to run for 1 kilometers daily, what will happen to him? He will have difficulty in breathing. Number 2, his heart rate will increase. That is massive tachycardia, which is very, very dangerous, and it might even cause sudden heart attack and even death. What is the first thing I told? If I tell this small boy weighing 140 kilograms, if I tell him to run, what will happen to his respiration? Number 1. Number 2, his heart rate will increase, leading to even sudden cardiac arrest or even death. Third complication is, he will have knee joint injury or knee joint pain. He cannot even sit for toilet. Fourth complication, by chance if he gets a knee joint injury by running fast in the treadmill, he will have to do unnecessary knee joint surgery. So 4 dangerous complications. 4 dangerous complications of what? Running of an overweight person. Say is 140 kgs. Is it possible for this boy to run. It is practically not possible. It is practically not possible. Okay, number one. Next point what I want to discuss is, so how did I reduce his body weight from 140 to 70 kgs? Without running, without skipping, without treadmill. I am going to explain this in detail in the last. Okay. Second point for discussion is, okay, if a normal healthy person is running for, is going for slow walking for 1 kilometer, if a normal healthy person is going for a slow walking for 1 kilometer, he can burn maximum 40 to 50 calories. Just keep it in mind. If a normal healthy person, I am not talking about diseased person, I am talking about a healthy person. If a normal healthy person goes for a slow walking for 1 kilometer, he can burn maximum 40 to 50 calories for 1 kilometer. If a normal healthy person goes for a fast running for 1 kilometer, he can burn maximum 80 to 100 calories. That's all. So slow walking 1 kilometer, 40 to 50 calories. Fast running 1 kilometer, 80 to 100 calories. So I am talking about normal healthy person. Okay. So now let us talk about an overweight person. Let us talk about a person eating sugar tablet, pressure tablet, cholesterol tablet for so many years. Let us talk about a person, a chronic diabetic person with knee joint pain. Let us talk about a handicapped person. Let us talk about a person, a diabetic person who is having a big wound in the leg. So did you understand? These are the 5 situations which I told you. Okay. Number 1, an overweight person. Number 2, an overweight person eating sugar tablet, pressure tablet, cholesterol tablet for so many years. Number 3, a diabetic person with severe knee joint pain. Next is leg disabled person. That is handicapped in the leg. 5th, a person with a wound in the leg due to diabetes. See, is it possible for these 5 people to go for running for 1 kilometer, at least 1 kilometer? Is it possible for these 5 persons to go for fast running for 1 kilometer? I am not talking about 5 kilometers, I am talking about just 1 kilometer. Is it possible for a person with 140 kgs to run for 1 kilometer so fastly? Think. Number 2, is it possible for a overweight person eating sugar tablet, pressure tablet, cholesterol tablet, insulin, thyroid tablet, constipation tablet, depression tablet, for this person to run for 1 kilometer every day so fastly? Is it possible? Think. Number 3, is it possible for a chronic diabetic person with severe knee joint pain? Most of the chronic diabetes will have severe knee joint pain. Is it possible for a diabetic person with knee joint pain to run for 1 kilometer? Is it possible? 3, is it possible for a diabetic person with a wound in the leg to run for 1 kilometer? Is it possible for a handicapped person in the leg to run for 1 kilometer? So, these are the 5 situations which is practically not possible. Right? So then you can ask me, how did you reduce this 140 kgs to 70 kgs? You can ask me, how did you reduce this 140 kgs to 70 kgs? Total 70 kilogram weight loss. Did you understand? It is very, very easy to reduce overweight. That is the important news which I want to tell you. The most easiest disease in the world to be treated without walking, without running, without skipping, without treadmill is overweight, high blood sugar and bad cholesterol. Let me repeat once more. The easiest disease in the world to be treated without running, skipping, treadmill is overweight, high blood sugar and bad cholesterol. Do you know why? Because there is only one reason for all the three diseases which I told you. Because there is only one reason for all the three diseases which I told you. Right? So, it is very, 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 very easy to reduce your overweight. It is very easy to stop your sugar tablets and insulin. It is very easy to stop your cholesterol tablets. You must eat your home food in a balanced form with correct amount of protein, fat, vitamins, minerals and carbohydrates. That's all you have to do. That's why I'm telling you, the easiest way to reduce obesity, to stop your sugar tablets, pressure tablets and cholesterol tablets is you must eat your home food in a balanced form with correct amount of protein, fat, vitamins, minerals and carbohydrates. That's all you have to do. The speciality of my weight loss clinic, no protein powder, no juice, no tablets, no running, no skipping, no treadmill, no bariatric surgery, no protein powder selling business, no juice selling business. Got it? I give a balanced home food diet plan. I give a balanced home food diet plan so that you can reduce your overweight without walking, without running, without skipping, without bariatric surgery, without protein powder, without juice, without tablets and without bariatric surgery. That is the specialty of my weight loss clinic. Okay. So now let me go to the discussion. Okay. So the carry-on message is, even if a person goes for slow walking for 1 kilometer, he will burn 40 to 50 calories. If a person goes for fast running for 1 kilometer, he can burn maximum 80 to 100 calories. So keep this in mind. Okay, keep this point in mind. Okay, now normally most of the people used to eat morning to night. Okay, if they are eating from morning to night regularly, morning tiffin, 11 a.m. snacks, afternoon lunch, 5 p.m. snacks and 9 o'clock dinner. If they are eating, they will eat almost 1500 to 2000 calories. 1500 to 2000 calories. Some people will eat up to 2500 calories. Got it? So one day, from morning to evening, most of us will be eating 1500 to 2000 calories. Some people will eat up to 2500 calories. So your input is 1500 to 2000 calories. And even if you go for 1 kilometer fast running, you can burn maximum of 100 calories. What is the use? No use. That is I am telling you. You cannot reduce your overweight by running. You cannot reduce your overweight by skipping. You cannot reduce your overweight by treadmill. Got it? Because even if you go for fast running for 1 kilometer, you can burn maximum 100 calories. But morning to evening, your home food will be around 1500 to 2000 calories. So just by running for 1 kilometer and burning 100 calories will be no use at all. Okay. So what is the carry home message? You cannot reduce your overweight by running, skipping, treadmill, whatsoever it may be. You cannot. Because your intake is almost 1500 to 2000 calories, and even if you go for fast running, you can burn maximum 80 to 100 calories. And the most important is, if you are an overweight person, you cannot go for fast running even for 1 kilometer. If you are an overweight person, you cannot go for a fast running for 1 kilometer, because you will have so you cannot go for fast running. Number 2, if you are an overweight person with sugar, pressure, cholesterol and eating this much of tablets, you cannot go for fast running even for 1 kilometer, because again you will have, be very careful. Number 3, if you are a sugar patient or a pressure patient or a bad cholesterol patient, and even if you are not overweight, most of the sugar patients will have severe knee joint pain. So you cannot go for fast running even for 1 kilometer. So you cannot stop your sugar tablets, insulin and cholesterol tablets by walking alone. It is not possible. So what is the carry home message? If you want to reduce your overweight, if you want to stop your sugar tablets, insulin and cholesterol tablets, the only way is you must eat your home food in a balanced form with correct amount of protein, fat, vitamins, minerals and carbohydrates. That is the carry home message. I repeat the carry home message. Only if you eat your home food in a balanced form with correct amount of protein, fat, vitamin, minerals and carbohydrates, you can reduce your overweight, you can stop your sugar tablets, pressure tablets, cholesterol tablets and insulin gradually, permanently and lifelong. I am not telling you not to go for walking, running, skipping and treadmill. You must go for a slow walk. If you are an overweight person, if you are suffering from diabetes for so many years and you are having knee joint pain, if you are eating pressure tablets, cholesterol tablets for so many years and you are very emaciated, you must go for a slow walking. To keep you mentally fit and physically fit. So that is also a carry home message. But you cannot reduce your overweight by running. Don't forget that. You must go for slow walking daily only to keep you physically fit and mentally fit. Right? Shall I repeat the carry home message once more? You cannot reduce your overweight by walking, running, skipping and treadmill, because I have told you the reason. You cannot reduce your sugar tablet, pressure tablets, cholesterol tablets and insulin by walking alone. I told you the reason. So which is most important? Is it the food most important or is your walking most important? Is it your food which is most important or is it your walking most important? Balanced home food is the most important. Balanced home food is most important. combined with slow walking will give you some benefit. So if you want a diet plan, if you want a balanced home food diet plan from Dr. Sheban, from me, you can call it 944-3487-004. Right? I think this video was very informative to you. Right? Please share this video to your good friends who are running daily to reduce their overweight, who are running daily thinking that they can stop their tablets and insulin. Not possible at all. Only if you eat your home food in a balanced form with correct amount of healthy protein, healthy fat, vitamins, minerals and carbohydrates. Only if your food is in the balanced form, you can stop all your tablets. You can reduce your overweight very easily. Very easily. See, this boy, I did not even tell him to go for walking. It is a sin if I tell him to go for running. Am I right? If I tell this boy with 140 kgs to go for running, it is a sin. S-I-N. Because he will have think. So I hope this video was very informative to you. Stay tuned with Dr. Sheban. Okay. Thank you so much. Thank you.